My name's Mandy Kass. I'm a genetic counselor with Ironwood, and today we're going to be talking about an inherited risk for cancer known as Lynch syndrome. So what is Lynch syndrome? Lynch syndrome is a genetic condition that causes someone to have a much higher likelihood of developing colorectal and uterine cancer, amongst other cancer types as well. But about 3 to 5% of all colorectal cancers are associated with Lynch syndrome. So it is very prevalent. And it's the most common hereditary form of colorectal cancer, impacting about 1 in 279 individuals. So as you can see from this table, the main cancer risks tied to Lynch syndrome, as we discussed, were colorectal and uterine cancer, but there are a lot of other cancer types that we can see. This includes ovarian cancer, prostate cancer, small bowel cancer, amongst many others. So it really impacts a wide variety of cancer spectrums. So what actually causes Lynch syndrome? To understand that, first we need to understand a little bit more about our DNA. Our bodies are made up of trillions of cells, and each of our cells contains our genetic material in the form of DNA. Now, our DNA consists of over 20,000 different genes, and each of these genes perform different functions. So as a whole, all of these genes essentially act as a blueprint for our body's normal functioning and development. Some of the genes in our bodies actually work to protect us from cancer. And over time, we might acquire mutations within these cancer protection genes that cause them to no longer function properly, and in turn can lead to cancer. Now, these acquired mutations can occur for a variety of reasons, including environmental exposures, lifestyle factors, sun exposure, normal aging, just to name a few. So when cancer happens because of these acquired mutations that happen over our lifetime, we refer to them as sporadic cancers, or sometimes you might hear them referred to as environmental cancers or lifestyle-related cancers. Sometimes, however, someone is actually born with a mutation in one of these cancer protection genes, and that makes them more susceptible to certain types of cancer because their bodies have less ability to protect themselves from these cancer types. When cancer occurs in these individuals, we refer to them as hereditary cancers because it's caused by that inherited genetic mutation that that person was born with. So what actually causes Lynch syndrome? Lynch syndrome is caused by a mutation in one of 5 different Lynch syndrome genes. These include MLH1, MSH2, MSH6, PMS2, and a gene called EpCAM. And collectively, we refer to most of these genes as our mismatch repair genes or our MMR genes. And basically what these genes do is they work in our body to help recognize and repair damage within our DNA. So as you can probably imagine, if any of these genes aren't working properly and we don't have that repair system, that's when we can run into trouble and see cancers developing. So how is Lynch syndrome diagnosed? Well, there's a couple different approaches that we might take to determine if Lynch syndrome is likely. Simple screening tests can be performed on tumor or cancer tissues. The 2 most common tests are microsatellite instability testing, or MSI, and immunohistochemistry testing, or IHC. The results of these tests can basically tell us whether it's more or less likely that someone has Lynch syndrome, and this helps us determine whether more specific genetic testing should be considered. Now, if these tests were to come back abnormal, indicating that Lynch syndrome could be a possibility, that's when we want to move forward with more confirmatory Lynch syndrome testing. And we refer to this as germline testing or hereditary genetic testing. It's typically done on a blood or a saliva sample. The accuracy between those 2 methods is identical. It's just 2 different methods to extract the DNA. And what we're doing is we're looking at the copies of those Lynch syndrome genes that someone was born with to determine if one of those genes is mutated or not working. And if we do identify that, then that would confirm the diagnosis of Lynch syndrome. So what can you do if you have Lynch syndrome? After being diagnosed with Lynch syndrome, it's important to work with your provider and your genetic counselor to go over screening options and preventative options. Now, depending on your particular Lynch syndrome gene and your family history, these screening options are going to vary. But some of the options that we might consider for you would include colonoscopies starting at an earlier age than usual and being done more frequently. We might also recommend upper GI surveillance, so that would include an upper endoscopy. We always recommend an annual physical exam with your primary care provider, and this might also include a neurological evaluation. We also recommend that some women with Lynch syndrome consider preventatively removing both of their uterus and their ovaries to help reduce the risk of those cancer types. And we also often recommend that patients with Lynch syndrome see a dermatologist on an annual basis for a routine skin exam. So again, some of these options are going to vary just depending on your particular situation, but those are some of the things that we might want to incorporate for you. So now that we've gone over some of the basics of Lynch syndrome, the cancer risks, how it's diagnosed, let's talk about how it might impact your family. So Lynch syndrome follows what we call an autosomal dominant pattern of inheritance. So what that means is we all have 2 copies of every gene in our body, one from mom, one from dad. So if we imagine that these are our Lynch syndrome genes, let's say there are MSH6 genes. If you have a mutated copy of that MSH6 gene that you were born with, that is enough to cause Lynch syndrome, even though the other copy is still working. Now what that means is if you were to go on to have children, there's a 50% chance that a child might inherit the mutated copy of that MSH6 Lynch syndrome gene, but there's equally a 50% chance that the child might inherit the working copy of that Lynch syndrome gene, and therefore they would not have a diagnosis of Lynch syndrome. It's also the same 50-50 risk for your full siblings. We do, of course, recommend genetic testing for your family members so we can better identify who else in the family might benefit from some of these proactive screening changes. So when should you consider genetic testing for Lynch syndrome? Well, there's certain features that we can look for in a personal or family history of cancer that could be suggestive of Lynch syndrome. Some of these might include colon cancer or uterine cancer being diagnosed before the age of 50, or if we see a personal or family history of 2 separate Lynch syndrome cancers being diagnosed in the same person. And when we talk about Lynch syndrome related or Lynch syndrome associated cancers, you'll see them listed here at the bottom of the slide. We're also looking for a family history of Lynch syndrome associated cancers in 3 or more family members, all on the same side of the family. We're also, of course, going to consider any abnormal tumor screening. So that's going back to that MSI or IHC testing that we talked about for someone that has a personal diagnosis of certain cancer types. So if any of these features sound consistent with your personal or family history, it's definitely time to think about genetic testing for Lynch syndrome. Being diagnosed with Lynch syndrome can be overwhelming for anybody. So it's important, if you've been diagnosed with Lynch syndrome, to remember that healthy habits, such as maintaining a healthy weight, getting regular exercise, and minimizing alcohol consumption can all help reduce your risk of cancer. There is also some data to suggest that taking aspirin daily can help reduce your risk of colorectal cancer if you've been diagnosed with Lynch syndrome. But we, of course, recommend talking about that option with your providers first to make sure that it's appropriate for you. Also, regular cancer screenings for both women and men are so important when it comes to prevention. Now, we know that these screening guidelines can change over time, so it's important to stay up to date with your providers and your genetic counselor so we can make sure that you're set up with the best possible screening plan. For more information about hereditary cancers, visit our YouTube page or our website.